Hello and welcome to World Bank Live. I'm Paul Blake. The past few days have seen some hopeful news when it comes to the development of COVID-19 vaccines. Of course, these are still very early days, and once vaccines are approved, a whole new set of challenges confront us, namely how to finance and distribute those vaccines to the people who need them. This is a deceptively complicated question that has many layers. For one, how do you decide which people get the vaccine first as a priority access? And beyond that, how do you set up the incredibly complicated supply chains that are needed to move the vaccines from the factory floor to the actual patients who need them? These and other questions are made all the more complicated by the limited resources and fragile health systems found in developing countries. And to help address these and other challenges, the World Bank Group has recently approved $12 billion to help developing countries finance the purchase and distribution of COVID-19 vaccines, as well as tests and treatments. To learn more about the work of the World Bank Group and what it's doing to help when it comes to COVID-19, let's talk now to Dr. Mohamed Pate, the Global Director for Health, Nutrition, and Population at the World Bank, as well as Elena Sterlin, Senior Manager for Health and Education at the International Finance Corporation. That's the private sector arm of the World Bank Group, for those who might not be familiar. Welcome to you both.
Thank you.
Thank you.
Mohamed, let's start with you. Let's talk about that headline figure, $12 billion. What has the World Bank approved that money for specifically, and how quickly do you think you'll be able to sort of get that support out to countries?
Thank you. I think even before the COVID-19 pandemic, the bank has been a major supporter of countries to strengthen their health systems and to be prepared for emergencies like we've seen. So with the COVID-19 pandemic earlier this year, as you know, the bank approved the MPA, the Global Health MPA, which provided a framework for the emergency response, but also for strengthening the health system to be able to cope with the challenges being posed by the COVID pandemic, including anticipation of role of vaccines and therapeutics. So the $12 billion that the bank's board approved in October was really built on that framework of the MPA that allows countries to purchase those vaccines, but also to deliver them. It's not about getting the vaccines, but the complex challenge, which you've alluded to, of actually delivering them, vaccinating people. That is also something that the bank is well positioned to support, given that it has reached already more than 100 countries in supporting them on the emergency front. So it's sort of taking that to one level higher to enable them also deliver the vaccines. And I think that's something that we'll have to do with the government in the driver's seat, but also with our partners. And in that regard, we've got a goal, an aspiration really, to support at least 100 countries, get ready to deliver those vaccines and other tools within the next 100 days. And that is something that we're very keen to pursue. And I think collectively we can be able to do that with our partners and with the country governments that we are supporting.
And I've been reading a little bit about some of the news here in the past few days. Some of these vaccines, the process of getting them to countries is incredibly complicated. They need to be kept at very, very, very cold temperatures. Do you need to wait for a vaccine to be approved before you can start laying the groundwork for distribution, or can some of that support start being extended to countries already?
That support, actually, that preparation needs to happen months ahead of when you actually get the vaccines, because the ultra cold chain that is required, for instance, for the front-runner vaccines, the Pfizer and Moderna, which have been recently announced, will require a different level of cold chain than traditionally has been used in vaccination programs. And that has to be done. The training of the health workers, the policies and regulation, the arrangements to ensure that no one is left behind within countries, the community mobilization doesn't have to happen when the vaccines have already hit the airports in the countries where they will be used. They need to start even right now. And that's why the bank's support is really to lay the foundation, even as we anticipate the vaccines to become available. And the work on readiness is so vital to enable us use optimally the vaccines that may become available in the next several months in many of the countries that we work in.
And Elena, let's get you into the conversation here. I know you and all our colleagues over at the International Finance Corporation are working with the private sector. You guys have this global health platform that, if I'm not mistaken, is valued at about $4 billion. Can you talk to us a little bit about that? Mohammed gave us the background of the World Bank's work. Talk to us a little bit about this global health platform and what exactly it's sort of doing to help manage and sort of confront this pandemic.
Thank you very much, Paul. So maybe before I start talking about the global health platform, I wanted to say a few words about a first platform that we approved once with the onset of COVID, and that was really a rescue platform. So we approved $2 billion to generally a variety of sectors, but about half of it is now going to the health sector. And that's really to provide liquidity to companies to survive the COVID. A lot of it, for example, in the healthcare services space, there's been about 60–70% drop in revenues because a lot of the chronic patients stopped going to hospitals and stopped taking treatments. So the hospitals need to survive it. The same situation is in products. There is a lot of difficulty getting raw materials and supplies for production of pharma. And so the pharma companies need to create much bigger stockpiles of raw materials. So a lot of liquidity, about $1 billion of liquidity that we had to provide to unblock the supply chain and the services side. So that was the first facility. Then in August, we approved the $4 billion facility, Paul, that you're referring to. So the facility has two purposes. In the short term, it's really to facilitate supply of critical products and services to the countries. Again, the main issue we're seeing is blockages in supply chain when the products are not getting to emerging markets. And the second purpose, which is longer term purpose, is creating stability and resilience in emerging markets. And it's really about building their own production, their own supply chain, so that in the future, they don't face similar situations.
And Mohammed, Elena was there talking about the sort of bottlenecks and some of the supply chains. One of the big things that I think a lot of people are concerned about is access to the vaccine once one is approved. What is your big concern if developing countries aren't able to access the vaccine? What is the sort of global health impact if developing countries don't have access to the vaccine?
Well, vaccines will be key to reopening economies all over the world, to saving lives and livelihoods. Now, if we have a world where one part of the world is able to access and reopen their economies through the use of the vaccines, and another part that is basically having to wait months before they start getting access to the vaccine, that will be an unfortunate situation for the world to find itself. I think the approach to have fair allocation system is the right one. And the bank's effort to enable countries, even the low-income countries and low-middle-income countries, to access those vaccines as closely as possible behind sort of the high-income countries will be key to really unlocking the global economy, because it's all countries that are affected. And COVID has not respected national boundaries. And I think we're all in this together as a global community. So that's really very important to have the lower income countries also access these vaccines. We've seen that in the past where there were pandemics and it took a while for essential therapeutics to become available in parts of the world long after they become available in the high income countries. We're hoping that in the case of COVID-19 pandemic, there will be global solidarity and there will be effort by institutions like the bank and others to ensure that in fact that doesn't happen, so that every life actually has a fair shot of getting saved, but also all economies have the same access really to the vaccines that will enable them to really come back to near normal or as near normal as possible.
And if you're just joining us, this is World Bank Live. We have Elena Sterlin from the International Finance Corporation and Dr. Mohammed Pateh from the World Bank here with us this morning talking about COVID-19 vaccines, treatments as well as testing, and the work that the International Finance Corporation as well as the World Bank is doing to help developing countries get access to those treatments, that testing, and those vaccines. Elena, I want to come back to you now. And for people who might not be as aware, can you talk to us a little bit about the role that the private sector plays in health systems and what the private sector is doing in many of these developing countries to strengthen health systems? Elena, I think we're just having a bit of trouble hearing you. I don't know if you're...
Apologies. Can you hear me now?
We can hear you now.
Okay, perfect. Let me start with the vaccine and just maybe leveraging on what Mohammed was explaining. So in the vaccine space, in emerging markets, a lot of the private companies are providing effectively contracting services to large international pharma companies like AstraZeneca or J&J. So we're seeing, for example, in India, two companies, BioE and Serum Institute, looking at providing subcontracting, or the same Lemont for AstraZeneca in Mexico. So a lot of subcontracting is going on. And then if you're looking at other side of more complementary services, complementary products to vaccine distribution, and deployment, it's things like production of big increase in production of gloves, syringes, and so on, like complementary PPEs. That has spiked dramatically. Then if you look at more the services side, we're seeing a private sector getting much more involved in diagnostics. We're seeing much more partnerships and very productive partnerships where private sector is contributing to early diagnostics, and the big partnerships around digital. We're seeing governments adopting new regulations, allowing for digital, for telemedicine and other monitoring of patients at a distance, and the private sector providing digital solutions. And I'm happy to talk more about it if that's of interest, Paul.
Yeah, and we'll go into more of it here over the next few minutes. One question I had for Mohammed is, Mohammed, you were talking a lot there about the importance of making sure developing countries have access to the vaccine. But within countries, developed or developing, how do you decide which groups, which demographics get the vaccine first? How do you decide, when there is a limited supply, who's at the front of the line?
Yeah. Indeed, there is limited capacity to manufacture the vaccine. So in the short term, there will not be enough vaccines to go around every country and within countries. So how do you prioritize? There is an allocation framework based on certain principles that have been developed by the normative agency responsible for such allocation frameworks, in this case, WHO, which basically says that we should prioritize the frontline health workers, the frontline service providers, teachers, and others that are essential, and then to also prioritize those that are at risk, the elderly and those with comorbid conditions. And then as more vaccines become available, then countries will make a determination towards equitable distribution within the country so that no one is left behind. That is not only in terms of statement of principles, but in terms of how to organize the distribution so that neither geography or income or really other considerations skew the vaccine allocation in a way that is unfair to most population. But that is something that national leaders will have to decide within the context of their countries. Hopefully, as more vaccines become available, everyone should be able to get that. So beyond the international sort of distribution or allocation between high income, middle income, and lower income countries, within countries themselves, I think there is an important aspect, which is to ensure that populations are not excluded either by gender or by profession or where they are. And the bank's financing, in a way, is also linked to that, in dialogue with the countries to ensure that there's an allocation framework that responds to the needs of populations equally within their respective countries.
To make sure governments are having a plan, they're thinking about how they want to roll this out. Elena, you were going into the role of the private sector earlier, and it sounds like it's very complex and multidimensional. Let's dig into it a little bit more. And when it comes to the vaccine and some of these treatments and some of this testing and the services that are needed around it, what are some of the major challenges that you guys are seeing at the International Finance Corporation when it comes to how the private sector is responding? What are some of the challenges the private sector is facing?
I think a lot of the challenges are really timing challenges. So there's a huge desire on part of many countries to get access and get access very quickly. And this is really unprecedented to come from research to actually moving the products within a year and moving it globally to global population, right? So that has never happened, and that's really the challenge. The typical situation would be you would do your research and development, which would take 2 to 5 years. You will then build much bigger facilities depending on market demand, and you will then start selling. But nobody has that level of patience to wait for another 5 years or so to make these things happen. So a lot of things need to happen in parallel. You have to do your R&D at the same time. You're already building your production capacity at the same time. You're finding buyers, and at the same time, you're figuring out logistics. So the complexity of what is being proposed and the parallel tracking of what typically is done sequentially is quite stunning, staggering. So if you start from the beginning, vaccines are not even approved yet. We have 2 front runners, which are very close at this stage, but fundamentally nothing is yet approved. Yet multiple companies like AstraZeneca, Moderna, J&J are building huge capacities already to supply the world with this unproved vaccines. So they're taking huge risk, and they obviously want to be de-risked for what they're undertaking. Then if you take it to the next stage, what is the market? We don't really know. We're still trying to discover how big the market will be. So how big are you building? And then if you overbuild, can you repurpose what you already built to do something else with these facilities? Or 2 years down the road, when the vaccine is not in such high demand, what do you do with these facilities? Because it's not a stable demand that we're expecting. And then the final piece, which I don't think anybody has their head around yet, is really around logistics. And it's early days. A lot of institutions are thinking about it. And obviously, World Bank is on the front line thinking and identifying what the gaps are and how to make sure we bridge them. But it's really early days still.
Yeah, I was listening to the radio this morning, and someone was saying how incredibly quickly the vaccine's actually been developed compared to previous vaccines. But really, the main challenge with this is going to be the distribution. The 2 that are showing early promise, they have to be kept so cold. And Mohammed, I was wondering if maybe you could give us some thoughts on that, about the challenges, especially in developing countries, that need to be addressed, for the efficient distribution of this vaccine and the vaccines that could be coming. You hinted earlier at the cold. Maybe you could talk a little bit about that and some of the other challenges that are going to be faced by developing countries.
Yeah. Before I get into that, just wanted to say one of the front runners, Moderna, for instance, is a firm that was supported by CEPI. So after the West African Ebola outbreak, I think based on the lesson that was learned in terms of development of vaccines and linking that to the research and the pipeline, CEPI was created and was hosted as a fifth at the World Bank. And it's one of those partners to the bank, and that has supported Moderna, that is now really one of the front runners in terms of the mRNA vaccines. This is just to illustrate sort of the global partnerships that the bank has been involved with, and how that is shaping, in fact, the response to the COVID-19 pandemic, even before we come to the countries. But as we have laid out, I think the challenge of delivery of these vaccines is nothing like what we've experienced in the past. This is a vaccine that is going to be targeted at a different demographic. Traditionally, vaccines are focused on children, occasionally some adults targeted, but here we're sort of anticipating large-scale vaccination of a different population. Not only policies and the regulatory environments within countries have to really take cognizance to the fact that these are new vaccines. The human resources in those countries have to be trained to be able to administer those vaccines, to manage the logistics and cold chain infrastructure itself, to forecast accurately. The data systems have to be able to really count who has received the vaccine and track them so that they can get a second dose, because these are all two-dose vaccines, and most likely there will be several two-dose vaccines. That information system has to be there. The health workers who will be the administrators of this have to be also protected in the short term with the equipment that is needed, the physical infrastructure. There are other attendant needs that have been disrupted. So there's a whole series of steps that will need to be in place, including engagement of the communities, so that they understand why these vaccines, that they are safe, that that they are also effective, and that there is no, to dispel any misinformation, in fact, that could really prevent people from accessing those vaccines. Because to get the value of the vaccines, not only do you need the efficacy, but you also need to have the coverage. A good vaccine that isn't delivered will not really yield the result that we're anticipating. So we need to have that delivery focus. And that's something that the bank has traditionally had a very large footprint in health sectors across the developing world, and has demonstrated that through the first phase of the MPA, reaching almost more than 100 countries with the emergency support. So riding on the back of that platform, we can help our clients really effectively plan to deliver, but also execute on the delivery. And that's something that we're on the way in terms of getting ready for that.
And Elena, Mohammed was just there kind of laying out just the breadth of challenges, from training workers, getting the PPE, getting the information out there to people so that they don't have that vaccine hesitancy. The need here, the need to get the vaccine out is immense. And I think of that phrase, necessity breeds innovation. Innovation often comes from the private sector. Can you talk about any examples of innovation that you're seeing to some of these challenges and to the rollout of the various health programs that the IFC is involved with?
Yes, thank you, Paul. So maybe just let me highlight 4 or 5 areas where we see kind of major progress. One, I already mentioned that a lot of countries are changing their regulation, which is also allowing for a lot of innovation to come in, which is really interesting. So one big area of change that we've seen is really around telemedicine and monitoring of chronic patients at a distance. And right now there is a lot of ability to do that, both through internet and with special devices that can measure all sorts of vital signs. So there are a variety of interesting companies that are coming up and expanding really fast. And just to mention a few, there is a health force out of South Africa, which is doing a really interesting model of leveraging nurses to support the doctors. So basically putting much more emphasis on frontline nurses. The second one, Baobab Circle, again in East Africa, which is doing a lot of work around managing chronic patients, which are most at risk during the pandemic right now. So how do you keep them healthy and protected from exposure to COVID? So that's kind of one whole area of the telemedicine. The other area is really around training of workers at the front lines. There are so few people right now, and there's such high demand for more people on the front lines treating the patients. So we're seeing a lot of nurses and former doctors coming from pensions, retirements, coming back, or people who are still at universities also out there trying to help. So how do you train all these new people, right? So there are multiple companies, but maybe just again mention one. It's called Body Health out of India, and they're doing a lot of frontline worker training at this point. And again, very interesting model, and we hope this and similar models will grow and will strengthen the more junior medical personnel even for longer term. So then there's a more general theme around the collection of data, analysis of data to help governments to manage the pandemic. And just to give another example, there's a company, Zenesis, out of US, which is working a lot across all regions, very active in Africa right now, helping governments to to understand better the situation and help them manage this situation better. And maybe final one to mention is really around ID. There are lots of ID systems, and there's a lot of interesting work going on right now, how to link these ID systems to identifying and tracking COVID patients, and then maybe longer term moving it into electronic medical records and creating electronic medical records for the countries.
And I
imagine so those would be the ones I'd highlight. Mm-hmm.
And I imagine, those health records are vitally important, to know who's been vaccinated, whether they've had some of these vaccines are going to require two rounds of vaccination, and having that information and knowing who you're working with, I think is vitally important. And it's always really cool to hear all the different companies that you guys at the International Finance Corporation work with. And Mohammed, one of the reasons I always get so excited whenever we do one of these programs is your depth of experience. Some people might not know, before you joined the World Bank, you were the Minister of State for Health in Nigeria, if I'm not mistaken, and surely this isn't the first major health crisis that you've responded to, either in your previous capacity or in your capacity here at the bank. Can you talk a little bit about how some of that experience and your experience, perhaps maybe it was Ebola or some of the other crises that you've witnessed or been on the front lines of responding to, how has that shaped your thinking here over the past few months as you've helped the bank develop its response to COVID-19?
Yeah, so I think the bank has been involved in responding to almost all the major global crises and pandemics over the last several decades, from HIV to Ebola more recently, and then now to COVID. And one of the lessons was really the importance of us working with others in putting in place the global public good, so to speak, supporting the research and development, the kinds of work that CEPI is doing, the kinds of work that Gavi and others are doing, and also the analytical work that the bank has been doing on preparedness. That comes to bear, in addition to the work that the bank does in terms of financing countries to respond to whatever insights that have been developed from our global knowledge work. But secondly, one of the lessons that have been learned from the Ebola response, let's say in West Africa, is the importance of taking a globally coordinated approach that is really rallying around supporting countries. And that's why in the case of the COVID-19 pandemic, we work with WHO, with UNICEF, with Gavi, CEPI, and others, primarily to translate sort of the global commitments into action at the country level. And that is an important way, so that we don't go into countries with separate channels of engagement that is inefficient, but that we really prioritize countries in the driver's seat, whether it's the sort of the bank or the platforms like the Global Financing Facility, which has developed platforms across 36 countries that is led by the countries, but that we rally around that as the bank, and then we bring others. The readiness work that we are doing now, the bank has set this aspiration of 100 countries to be supported to get ready in 100 days. That is being done, and other partners like WHO, UNICEF, Global Fund, and Gavi have signed on to the same letter with the heads of the World Bank, the relationship with the World Bank, that is going to ministers of finance and ministers of health to say that let's work together to support you to get ready and to deploy those tools. That's one of the important lessons that we've heard. And finally, importance of really listening to communities and citizens. We've seen in past, like global polio eradication effort, that was stalemated because the global effort was disconnected from the aspirations of the communities within where we really want to deliver those interventions, and to frame our interventions that respects, responds, and also communicates in a way that people understand what we're trying to do. Otherwise, vaccines might be available and people may not really receive them, or may choose not to receive them because either they don't trust it or they don't fully understand. It's vitally important, and that's why the MPA and the vaccine effort that we're putting together has an explicit commitment and a component on risk communication and community engagement. That is so vital. Otherwise, the tool can be delivered to countries and people may not go forth and receive those tools, even though we know that it will benefit them.
Making sure people have the information they need, to the factual information they need, and those rumors and that misinformation out there doesn't spread. I think that's a very important part of this work. And if you're just joining us, this is World Bank Live. We have Dr. Mohamed Pate, the World Bank's Global Director for Health, Nutrition, and Population, as well as Elena Sterlin, the International Finance Corporation's Senior Manager for Health and Education, here on the line with us this morning, talking about COVID-19 and the vaccines and the treatment and the testing that is needed, as well as how the World Bank Group is working to help countries and the private sector make that available to the people who need it. Elena, just as we start to kind of wind things down here, it's still sort of 9 months or so into this crisis, still feels like we're in kind of crisis response stage, but maybe starting to turn that corner, and we're starting to make some of these investments to get these vaccines and this treatment and this testing out there. Do you think some of the investments that are being made today to respond specifically to the COVID-19 pandemic can pay dividends in the future in helping countries manage and handle and prevent future shocks and future crises in a way that they don't become as big of a hit on society and on economies in the way that COVID-19 has? Do you think there's kind of future dividends that will be earned from the investments we're making today?
Yeah, absolutely. I think the fact that there's been so much change in regulations allowing for much more innovation in healthcare space will pay off big time. Right now, we're just reacting to immediate crisis, but longer term, patient management outside of hospitals or blockchain for supply chain and medical supplies, and all of that will pay off, I think, in a big way. The other two areas that I think we haven't talked that much about, but I think that's where I'm expecting also quite significant changes going forward, is much more partnership between private sector and public sector. I mean, we could see maybe in the past when private sector was very small or mainly comprised of SMEs, it was much more difficult for public sector to partner with private sector. But right now, there's a lot of very strong corporatized private sector. And I think the opportunity for such partnerships when necessary, can strengthen both sides and can definitely strengthen government's ability to deal with future crises. So I would predict a much closer partnership between private and public sector going forward. And on the product side, I would expect much more local production. So whether it is local production of active pharmaceutical ingredients, or medical equipment, I mean, we're seeing a lot of interest from countries and companies in emerging markets to localize such production to ensure long-term resilience.
All right. Well, Elena, Mohamed, thank you so much for taking the time to be here on World Bank Live this morning. I know you both have incredibly busy schedules, so the chance to get all this knowledge from you guys is a real pleasure.
Thank you.
Thank you so much.
Elena Sterlin is the Senior Manager for Health and Education at the International Finance Corporation, part of the World Bank Group. Dr. Mohamed Pate is the Global Director for Health, Nutrition, and Population here at the World Bank. If you weren't able to tune in from the beginning, you'll be able to watch this back. Just go to live.worldbank.org or check out our YouTube channel or any of our social media channels. And if you want to learn more about what the World Bank Group is doing to combat and help countries combat the coronavirus pandemic, head on over to worldbank.org/coronavirus. I'm Paul Blake. You can follow me at PaulNBlake on Twitter, and you can find out more from our COVID-19 series at live.worldbank.org. In the meantime, stay healthy, stay safe. We'll see you back here again soon. Goodbye.